All right, as folks are starting to trickle in, we can go ahead and get started. Hi, everyone. Thanks for joining and welcome to today's webinar. My name is Kate Talbert, Director of Reporting and Analytics with CRISP Shared Services. And today we're going to be going through information about enhancements to our reporting tool, Value-Based Care Insights, or VBCI. Our partners at Milliman Med Insights are going to be here to demonstrate some of the new features. So Kevin, if you can go to the next slide. Some housekeeping items. Today's webinar is being recorded, so the slide deck and recording of the webinar will be distributed to attendees and available for anyone who is not able to join. All audio lines are muted to avoid distractions, so please use the chat box feature of Zoom to type in any questions, and we'll make sure to get to them during the webinar. We will have time for questions at the end as well. For today's agenda, I'll provide an introduction to the VBCI reporting suite. We'll talk about some of the data that's available there and specifically timeframes of the data. We'll also talk about how to access the tool, and then I'll turn it over to Katie to do a demo of the dashboards. Okay, so for background, the Milliman Med Insights VBCI tool allows hospital users to analyze cost and utilization trends for their Medicare fee-for-service beneficiaries using the Medicare claim and claim line feed CCLF data. The reports feature interactive dashboards, so they allow users to drill from a summary view into patient details and filter reports for things like service category, avoidable services, and post-acute care, among other things. The beauty of this tool is that it leverages benchmarks. So by leveraging both national well-managed Medicare and state of Maryland benchmarks, the VBCI tool helps users to identify cost savings opportunities and actionable strategies to lower the total cost of care for your Medicare beneficiaries. The data that the tool contains is the last 36 months of the Medicare claims or CCLF data with a 2-month data lag. Based on the CCLF data runout, there is an additional 3-month data lag for attribution or MPA attribution. So for example, if the CCLF claims data is through April 2024, the report will show the beneficiaries through January of 2024. And I believe at the moment we have data through March of 25. Hospitals are assigned beneficiaries based on their zip code following a 100% geographic attribution model, similar to HSCRC's MPA attribution approach. To access the tool, you need access to CRISP's HIE portal, where we have a tile for value-based care insights. So after you log into the portal.crisphealth.org, you'll see a tile for VBCI that you click on in order to get access, and it would be your hospitals or group of hospitals data that's available there. If you do not have access to the tool and you belong to a hospital, you believe you should have it, you can submit a ticket to vbci-support@crisphealth.org, and we can work with your HIE administrators and our team to get you access to the tool. Here's just a screenshot to show you what it looks like. So if you have HIE portal, and this screen should look familiar to you, you'll see the different tiles with all the CRISP tools that you have access to. VBCI is one of those tools. And you would just click there twice to launch the VBCI tool. And now I'm going to turn it over to our colleagues at Milliman Med Insight to do a live demonstration of the new features. Katie?
Thanks so much, Kate, and thank you everybody for joining us today. My name is Katie Grotenhuis. I am a senior client service executive here at Milliman Med Insight. I have worked very close with Kate and the CRISP team on the implementation of VBCI. I also am here to ensure that you all are getting the most benefit you can out of the tool. So very happy to present to you today. For many of you, I may have met you in the past in our previous webinars. But as Kate alluded to, I really want to give an overview of VBCI, want to introduce some of the new dashboards that we have, some of the functionality that we've added, some of which has been based on feedback from you as users. And then really open it up to any questions. So as I'm going through this presentation, if anything comes to mind, feel free to jot it in the chat. But also, if you have use cases that you really want, that you'd really like to use this tool for, or you have, success stories to share with the group, please do let us know. I will have some time for questions and just collaboration at the end of the session today. All right, so I'm going to go ahead and share my screen. Are you all able to see my screen? Should see the home screen. Did that go
Not
through?
yet for me, Katie.
Nope. Okay. It looked like it may not have gone through. So let me try that one more time. Share, screen, share. All right. How about now?
Yes.
Yep.
All right. Uh-oh. Uh-oh. Okay. All right, so one thing I'm going to call out right away is that I am in your demo site. So everything is going to be de-identified. We're not going to see any actual provider information, any actual patient information, but the functionality and things should all reflect the experience that you get when you log into VBCI on your side. Kate did a really great job of introducing VBCI, but just to give a little bit more history on the product, VBCI has been a tool that has been in use for over 10 years. It continues to grow and develop. It was initially developed by consultants working directly with ACOs to look at ways that we can realize cost savings in our managed populations. And so really the goal of VBCI as a product is to provide a specific business need in a very user-friendly way that's visual, that's digestible, easy to understand interface, which really is going to unlock this data for more users. We want data consumers to be able to get insights, not have to be a data scientist or an analyst to gain insights on where opportunity aligns. And that's really what we're focused on is opportunity. So as Kate alluded to, one of the biggest things that we leverage within this tool is our benchmarks. So we have, as she mentioned, our well-managed benchmarks. Those are really developed and defined to show, the best performing organizations and benchmarks. And then we also have Maryland specific benchmarks so that you can compare yourself to how you are performing overall against your peers in the state of Maryland. I'm going to start off with just some high level overview, and then I'll start going into some of our new functionalities. But as you log in, navigation, there's a couple of things to note. One, we've got an upper right-hand menu here where we have global filters. Global filters are filters that you can put in place, and when implemented, are going to filter the entire portal, any dashboard that you navigate to as a whole. Slightly different than some of the filters we'll look at in dashboards where they're going to filter the view that you're currently looking at, but global filters are going to do just that. They're going to globally filter the interface that you're working on. We have a left-hand menu for navigation. So there are a couple of different ways as we go through this, again, trying to make it intuitive, user-friendly to navigate through VBCI. One is the left-hand menu. So you can always access any dashboard by going to the left-hand menu. But as we get into the platform here, you'll see that there are hyperlinks built in to kind of help drive the story that you're looking at. So when we kick things off, we'll really start out at the executive summary. This is going to provide an update for your organization on where you stand in some key KPIs. We're going to look at total beneficiary years, risk score, PBPYs, your total paid, and your cost savings opportunity. When you log in, your access is going to be set up specifically for your facility and include the members that are attributed to your facility based on that geographical MPA attribution. As I mentioned, cost savings opportunity is kind of the bread and butter here. So what does that really mean? we're going to look at your actual experience, your cost and utilization from your facility for your assigned population, and compare that to our well-managed benchmark. And if you were to realize and be performing at a well-managed benchmark, what opportunity and cost savings would you be able to obtain? Again, this is based off of 10 plus years of working with ACOs. And so we've developed drill downs that we know and we've had experience with other organizations getting success in, reducing that cost, earning that savings in these various categories. So we systematically have specific service categories with those drill downs to help guide organizations to areas that we know have seen success in the past from other similar organizations. From the executive summary, again, we're going to get those high level metrics. We can see where some of our top cost savings opportunities are. We have a cost savings opportunity dashboard. It's kind of a rolled up version of our cost model, which is where we're going to go next. One of the nice pieces about this particular dashboard is that you can export the whole page. Oftentimes our clients like to do this for executive updates, for PowerPoint presentations, et cetera, because it gives a really nice snapshot of the state of the organization. And then, we lead into, well, now that we know where we are, where are those opportunities and how do we kind of drill in to start realizing some of those? So as I alluded to, navigation can go through the left-hand menu, or we can bring you through hyperlinks in these dashboards. So naturally, you're going to see your top 5 cost savings opportunity. We're going to go to our cost model. Our cost model, as those of you are very well aware, is kind of the bread and butter of the product. This is really where we start our journey and looking at how our organization is performing across various service categories. And so here, the main takeaway and the main slice that we're looking at is how your organization is performing, how you're comparing to both our state of Maryland as well as our well-managed benchmarks, how you've been trending over time, what the average cost per service is for each of these service categories, how that translates into the percent of your paid PBPY, what that paid PBPY is from a straight dollar perspective, what the benchmark paid PBPY is, and then again, if you were to realize well-managed utilization, what kind of reduction in cost savings could you realize? Okay. So this is overview review for all of those who have been in the tool here for a little bit, and that brings me into what's new. What have we been adding since we've gotten together last? And we do have 4 new dashboards. These 4 new dashboards are focused on kind of site of care specialties. And so I'm going to go over here to my left-hand menu and I'll call out a couple of these and we'll walk through these from a use case perspective. The first 2 are looking at surgery. So we're going to look at surgery in 2 perspectives. We're going to look at surgery from an outpatient facility-based perspective, as well as an office perspective. Starting with our facility-based outpatient surgeries, this is important as we know, many procedures can be performed in both inpatient and outpatient settings with significant cost differentials between. So this dashboard is set up to allow you to kind of explore the relevant procedures, look at unit costs, look at provider and hospital details to identify opportunities for site of care. So we're going to look at this in 2 splits. From a facility perspective, we're going to look at your visits, your facility-based outpatient surgery visits that are occurring both in an ambulatory surgery center as well as a hospital outpatient setting. And then we can look at professional costs as well, and the breakout kind of between the anesthesia cost as well as the surgeon costs. This dashboard is going to look like every other dashboard in the general layout for the most part. So each of our dashboards really start with the cost model metrics that I just reviewed with you on the last dashboard. And then we're going to start to drill into, all right, if we know that we've got some cost savings opportunity, where do we go next? In this view, overall your organization is doing quite well. There is a bit of opportunity in our ambulatory surgery center if we were to really reduce that overall utilization. But generally speaking, what's great and what we see here is that a lot of your utilization is already occurring in those ambulatory surgery centers, which clearly, when you start to look at things by an average cost perspective, is where you want to be. That's going to be the least cost that you have. So you could start to look into this and say, well, I'm really between my hospital outpatient setting and my ambulatory surgery setting. I'm doing quite well, but I'm still slightly above or above our well-managed benchmark from a utilization perspective. And where might there be some opportunity there? We're also going to start with, trending. How have you been trending over time overall for facility-based outpatient surgeries? And then we also break it out again between those HOP and ASC settings. And the first place we want to go is, at that service line detail. So what type of services are occurring in these outpatient facility-based surgeries? So you can look at that. I will call out that all of the tables are sortable. So if you're really looking at kind of the services that have the highest utils per thousand, you can sort it that way. You can look at, the highest paid per service, those high dollar accounts. And then we can start to look at not only our overall utilization, but how that particular service line is stratified across your hospital outpatient and your ambulatory surgery center sites of care. Okay. And then as you move down from, looking at line of service, we can get to that next level detail. So if there is a line of service that you want to take a look at, I am going to select one here. I'm just going to sort by my high volume services, and I'll look at, I'll select one of these. As I select this checkbox of my service line detail, it's going to bring me down to what the actual HCPCS codes are and the procedures that are rendering within that service line detail. And we can, again, at that service code level, identify how many of those services are occurring, how that total utilization is stratified across your hospital outpatient and ambulatory surgery center sites of care. Additionally, if you want to take a different view at that, you can continue further down and start to look at the servicing providers. So who are the providers rendering this service? What type of provider, where they're rendering these from? And then again, from a provider perspective, how many of those procedures they're rendering, what their average cost is, and how that's contributing to the overall paid PBPY. We also have a toggle here if you wanted to look at it from a PCP perspective. Again, our PCP attribution within this program is really looking at a claims-based attribution. So we assign a member to a primary care provider who has the highest volume of E&M visits over the past 24 months. So if that is something that you were interested in, you could toggle over there. I know that you all use slightly different attribution, so I always want to call that out on how we are attributing members to a provider. And then the very last detail level that you can get to is the actual beneficiaries who are receiving these services. So you can take a look at who are these members, what's their risk score profile look like, who is their assigned PCP based on our claims-based attribution, what type of facilities and what types of surgeries are they receiving, and their contribution to paid. So that is one of the new enhanced dashboards that we have rolled out. Similar concept, but looking at our outpatient surgeries from an office perspective, we roll right into the next one. So again, great to have our surgeries occurring outside of the hospitals. Now we want to look at, so for those that we have surgery, how are we performing and where might we see some opportunity? And this one is going to follow very much the same structure that we just went over. We're going to start being able to look at our overall results when we compare to our well-managed benchmark. We can also see how our organization is doing in comparison to the state of Maryland average. And then we can start to drill into both that service line detail down to that procedure detail, over to the providers who are assigned to these members, and take a look at some of their overall performance relative to one another. And then lastly, getting right down to that beneficiary level detail. Any questions on surgery, the new surgery pages that we have, and looking at our outpatient surgeries? All right, I'm going to go on to the next new dashboard that we've just recently introduced, and that is our outpatient high-tech imaging. This is a great one. We know that imaging services are often overutilized. They represent a significant cost for many populations. And so the purpose of this dashboard is really, again, to allow users to explore where these procedures are occurring, what types of sites of care, what the associated unit costs are, and get down to those patient lists to identify areas of opportunity to kind of reduce unnecessary spend on these imaging services. So we break out the cost model here in a couple of ways. We're going to look first at service categories. So what type of imaging service are we looking at? And then we take that a step further, bringing in those sites of care. So for example, CT scans, are those occurring in facility, office, professional, or radiology centers, and allow you to get that full picture of where your actual utilization is occurring, and then how you're comparing to both the state of Maryland and benchmark, and where there may be some opportunity. As we drill through this particular dashboard, one thing that I will call out is by default, as we get into the details, we're looking at the whole picture of all of your high-tech imaging. But if you determine that your organization has a particular opportunity in CT scans, as an example, you can use this filter here to filter the rest of the dashboard specifically to our CT scans. So this is a unique feature in this dashboard, and it's oftentimes missed, and like to call that out, is that as you're looking at your opportunity across these services, you can choose to drill down specifically on one type of imaging services. So in this example, I'm going to focus on our CT scans. Again, I can look at how we're trending over time at a high level, as well as at each one of our sites of care. And then we can start to look at, all right, if we're looking at our CT utilization, what are the services that are being rendered that are adding up to our higher utilization? And then how are those stratified across our sites of care? So if we know that we've got 1,400 services here, we're averaging about 72.8 utils per thousand. I can take a look at where those are occurring. So we've got 119 in our facility with an average unit cost of 141. We've got 8 of those occurring in an office, slightly lower volume, slightly lower cost at $72. Most of them coming in at our radiology center at an average cost of $85. So generally speaking, we're doing a pretty great job at keeping these particular procedures in a radiology center that's got that lower average of cost. There might be some opportunity to move some of those over to office and take some of those small volume that's happening in a facility and try to move those over. If you wanted to look particularly at this HCPCS code in general and see, all right, well, who are the providers that are rendering this service? As I have it selected here, you'll see that As I scroll down, I've now got 2 dashboard related filters in play. So I'm already filtering this particular dashboard to look only at CT scans. And then I'm looking only at this particular service code. And so now I'm looking at the servicing provider details for the providers that are rendering this particular procedure. And I can see, who they are, how many visits they have, and what type of visits that they are rendering, what their paid PBPY is, and what that is from a contribution of the total paid PBPY for your CT scans of the service code. Again, you have a toggle if you wanted to look at similar information at a assigned provider perspective. And lastly, if you wanted to get to the actual beneficiary list who are receiving this particular CT scan, you've got it filtered all the way down to those individual members. The last new dashboard that I'm excited to highlight for you is therapy services. So I'm going to go, this one is focused on our, our PT, our OT, our ST, and our chiropractic services. So physical therapy, occupational therapy, speech therapy, chiro, they can all serve as both preventative investments as well as can be potentially overutilized services. So again, this dashboard is designed to give you insights into this cost utilization and allow you to see what types of services are being rendering and how that compares to benchmarks while you're monitoring and making sure that you're leveraging these great services that can be preventative measures. So that can be a good thing. We'll also keeping an eye, making sure that things are not being overused. Or abused from that perspective. And so here we look at kind of each of these services. And again, we're going to split it out from a facility and a professional perspective. Look at how your organization is performing on a utils per thousand basis when compared to both the state of Maryland and well-managed benchmarks, what average costs of services look like, what the paid PBPY is for your population, and then how that compares to both the state of Maryland and the well-managed benchmark. And if you were to have utilization aligned with well-managed benchmarks, what kind of cost savings opportunity might you find? We again will look at trending over time. I don't know if I mentioned this on the last one, but on all of our dashboards, you can look at this by default by month. But if you'd like a quarter by quarter or a year over year view, we've got that as well. We can break out then what type of services we're looking at. So how does PT versus OT versus chiropractic and speech therapy, how do those all contribute to that overall utils per thousand? In this example, you can see that physical therapy, without surprise there, is the highest utilized of the therapies. You can see how many services per beneficiary you're averaging, what the cost per service is, and what that paid PBPY is, and the contribution to the overall paid PBPY of your therapy services. And then we can drill down again a little bit further if you wanted to look specifically at, what type of procedures are being billed under our physical therapy. You can drill down looking specifically at physical therapy, what services are being rendered, how many beneficiaries are receiving those services, how many utils per thousand are getting that, how many average services per beneficiary of that particular therapeutic activity are they getting, what the cost per service is, and again, that paid PBPY and our contribution to the overall percent of paid PBPY that makes. And then as we drill down, again, you can get to the facility. So who is rendering this physical therapy? How many visits do they have? What type of visits? Again, we're filtered right now for physical therapy, so that's all you're seeing here. And then what the costs are associated for each of those facilities. We could sort here if we wanted to look at, the facilities that have the highest volume of these services, who is that, and what that cost differential might be across different facilities. And then as all of our dashboards get to, we can get right down to that beneficiary panel. So if you do want to look at, who are the beneficiaries receiving services, um, leveraging any additional filters, if you wanted to look specifically at, one of these uh, less expensive facilities, as you select that particular facility, will then filter your beneficiary panel down. To those members receiving services there, and you can get some more insight onto the services that each one of those beneficiaries are receiving and what the associated costs are there. Those are the new sites of service dashboards that we're excited to bring out. As I mentioned and alluded to when we started this presentation here, is that this product has been around for 10 plus years and it's continuing to evolve. And so we look forward to continuing to deploy new dashboards, new service categories as we identify more areas of opportunity and where we see other organizations realizing cost savings. To give you a little snippet of a couple that are to come, actually one main one that's to come is going to be our pharmacy dashboard. So we're going to be adding here towards the end of the year an additional dashboard looking at pharmacy drug usage and utilization. We're also going to have a care management specific dashboard that's going to allow you to stratify um, some of the beneficiaries who are attributed to your organization that may be potential candidates for some case management programs. So we'll likely have another one of these sessions as we continue to deploy additional dashboards. But since we've met last, those are the 4 new dashboards. As we also alluded to, in addition to just this content and these new use cases that you've got available to do, we've added some additional functionality into the tool. And so a couple of those items are, filter based. And so one of those is we're looking at a dashboard here and we're at a beneficiary panel level, is that we've added these checkboxes here so that you can actually create kind of cohorts of members and filter the dashboard that you're looking at by specific members. So if you are interested in looking at, a few of the members on any of the beneficiary panels, you have the ability now to select them, and what that's going to do is filter all of the metrics and reportlets above to look specifically at those members that you have selected. So that's some nice functionality that is net new. I think probably the most exciting and the most useful is in our global filter area. We have added a couple of global filter options. One, I'm going to just call out, unfortunately, is not in your demo site here, but it is the ability to look at the date range for our inpatient visits by an admit date or a discharge date. When we developed this tool, we by default looked at inpatient visits by the discharge date. That's the way that CMS pays for them. But we got feedback from a lot of our users that their internal reporting really requires to look at things by an admit date. So you do have the option, and it'll be right here, to toggle by an admit date or a discharge date. By default, it's going to be discharge date. That's what it's always been in the platform here. But if you're one of those organizations that really has a from date or an admission date based reporting structure for your internal reporting, you now have the ability to do that so that you could look at inpatient admissions from an incurred perspective. Chronic conditions is probably the next and most exciting global filter to bring to your attention. And this directly came out of feedback that we received from you all during our initial go live. And that was, this information is so valuable, right? All of the different sites of service categories, sites of care information that we can see is fantastic. But I want to really look at a specific cohort of individuals because I'm running a diabetes initiative or a congestive heart failure initiative. And is there a way to expand on our current chronic condition dashboard, where we are providing you kind of an overview of the chronic conditions that your population has. But is there a way to take this a step further? And if I wanted to look at my diabetes members here and the prevalence and understand how they're performing on other metrics like post-acute care or the cost model, can I do that? And that is feedback that we loved. The product team was like, that's a great idea. Yes, let's add that. So now we do have a member filter where you can select one or more chronic condition as a global filter. And what that means is everything throughout the interface is going to be filtered for the cohort of members who have that particular chronic condition. And with that, we've even allowed you to kind of specify conditional logic. So if you wanted to say, I think at the most basic level, you can select one cohort. And now our portfolio, our whole portal is going to be filtered for our diabetes population. But you'll see here that we have conditional logic, and you can select and or. So if you want to have multiple chronic conditions, so I want to see everybody who has diabetes and heart failure, I can select those two right now. Everything throughout the dashboard is going to be filtered for that cohort of folks. Or you can specify that you want an or conditional logic by clicking the toggle here. And then you're putting a filter in that says, give me all of the cohorts who have diabetes or heart failure. Okay. So this is super exciting. I'm going to select my diabetes members here. I'm going to give the system a minute to update this filter. This does have the full crisp de-identified data set in here, so it runs a little bit slower given that it's the full population. Your individual usage should populate a little bit faster here. But I'm going to look at diabetes and then hop back over to my cost model to show you what that looks like. All right, so I have selected the cohort diabetes. So you're going to be looking at everybody within your, every member that's attributed to your organization that has diabetes. You can see that now at the breadcrumb of global filters, I've got my diabetes global filter here. As I'm looking at my chronic condition dashboard, it's clearly filtered, which makes sense. Here are the beneficiaries that have diabetes. That's 100% of the members that we're looking at. The chronic condition summary dashboard gives you information on like their comorbidities, their average risk score, the costs associated with this cohort. And you can get to the member panel. You can see, how many of these members that have diabetes have other chronic conditions, what those chronic conditions are, how many they are, how many chronic conditions they have. But additional metrics like what is their util per thousand look like, what type of services are these folks receiving, et cetera, we didn't have. So now that we've got this filter in place, we can come back to our cost model. And that'll load up. And now your cost model is going to look at specifically for that diabetes cohort, what are the services, what are our utils per thousand, how are we performing? What you won't get is the benchmark. So that we don't have yet, and this is feedback that we've received already and we're looking into, we don't have disease-based benchmarks. So you'll see here that we by default blank out our benchmarks because we don't want them to be misconstrued. But you will get your cost and utilization information for that cohort of groups. So you can see, all right, now when I'm looking at inpatient cost and utilization for my diabetes members, my overall admits per thousand, 384.3. We're trending in the wrong direction here. This is our average cost per service. This is making up a 61.2% of my my paid PBPY, and here's the average dollars for that population. And then this one can, you can drill into each one of the dashboards that you had seen previously, looking specifically at your diabetic population. You can investigate post-acute care from a little different lens cap. You can put on the cap of, what type of post-acute care are my diabetic populations receiving after their discharge, and how that might be influenced, et cetera. So that is one that I wanted to call out. That is very exciting. Also wanted to make sure that everybody was aware that the benchmarks aren't at this point yet sliceable by chronic conditions, but something that we know is of interest, and we've taken note of that for a potential future enhancement. Lastly, we do have a provider NPI global filter that we've recently added. So if you had a series of physicians that you were interested in drilling into, you could select one or more of those physicians, and again, kind of globally filter the portal to look at the performance by those particular physicians that you've selected. Those are the main kind of enhancements and new features that we've added. I just want to call out a couple of things that have changed as well. One is our risk scores. So our risk scores are based on our CMS HCCs, but we are now blending the risk scores of CMS HCC version 24 and 28, which better aligns with the CMS processing. So there's slight change to the risk score calculation there. And then we also updated the home health measures from a 3 to a 14-day look back. So we're now expanded our view to better align with CMS to look at what's happening in the 14 days post-discharge versus 3 days post-discharge in our home health arena. All right, those are the new dashboards, the new features, the new enhancements, the changes that we've made over the last 6 months or so. I would love to open it up to the floor to see if anybody has any questions on anything that I covered, and or any use cases that you'd like me to cover or touch on. Open it up to the group.
Many thanks to you, Katie, for the great presentation, for all the enhancements that have been put in place already and what's to come in the future. I'm really excited about the chronic conditions one in particular. I do not see any questions in the chat. However, I'd like to remind folks that we do have an email inbox specifically dedicated to VBCI questions or suggestions. You can email us at vbci-support@crisphealth.org, and we will be sure to answer your questions. I see a question in the chat. Will a recording be available? Yes, we will be sending a recording as well as this initial slides that we shared in the beginning.